All right, Jessica Millian. She is a new podiatrist, right? And so, how long have you been here?
I started in August. I had a few weeks to do some orientation, and then I started seeing patients the second week of August.
Okay.
So about 3 months now.
And so you're with UH. Where are your offices?
I have 3 locations. I have one in Geneva at the UH hospital building, the physician suites, in Kanya on the special procedures unit in the hospital, as well as Ashtabula where there's the urgent care center.
They're on Lake Avenue?
Mm-hmm,
okay.
Right across from Rite Aid.
Right.
So.
Soon to be Walgreens.
Oh, really? I didn't know that.
They announced that they're going to be Walgreens are going to buy Rite Aid. So.
That's actually a great office location because you don't have to worry about steps or elevators. You can walk right in, and the office is the first office to your left. So that's a pretty nice, convenient location.
So what got you interested in feet?
I always knew I wanted to be a doctor, and it was just figuring out what I wanted to do. So I felt podiatry was a pretty well-rounded profession, and I had foot surgery when I was in college, and my podiatrist was really sweet, and I just followed her, and she was the one that motivated me to be a podiatrist.
Okay. And we were talking a little bit off air, and you're from the Rochester, New York area, which I spent a lot of time in because my son and daughter-in-law lived there for several years. It's a nice area.
It is. It's pretty quick, right off the 90. So my joke is I grew up in Rochester. I went to undergrad in Fredonia.
Sure, Fredonia, New York.
Yeah, and then we moved to Cleveland. So I just keep moving further west off the 90.
Yes, for Christmas one year, my son got us an Easy Pass because it's all pay they're going there. It's an easy trip, but you got to pay all.
I don't know how people don't have Easy Pass. It's so easy.
So my son's a little bit parsimonious. So the first few times I used it, because it went on his bill, I would go through, and then I would call up and say, "Hey, it's a charge on your bill, and we're going to turn around and go back through again."
Doubled up. Oh well.
But it is an easy trip there, and they've got a lot of nice things. So why did you decide then to move to Cleveland?
After undergrad, there's only 8 podiatry schools in the country, and the closest one to me, was Cleveland, Ohio. So, and my husband went to Case Western, so it was actually a perfect fit for us. So. Okay,
so what does he do?
He went to Case Western, and now he is an engineer with Avery Dennison.
Okay, yeah, that's like my son got his engineering degree, master's from Case. So where did you go in Cleveland?
So it was the Ohio College of Podiatric Medicine. It is located in Independence. However, probably about 4 years ago, it was bought by Kent State. So it's Kent State University College of Podiatric Medicine.
So did you go to Kent then, or were you in Independence?
I was in Independence, and the location still is Independence. It's just a Kent State school now.
So, all right, so tell me how much schooling it takes to become a podiatrist.
So
get your foot in the door.
Get your foot in the door. 4 years of undergrad.
Right. So what do you take? What was your major there?
Biology and chemistry. I had a major in biology.
That's good.
And then 4 years of podiatry school, and that's essentially medical school. We learn about all the systems of the body. We just have a focus on the foot and leg.
Okay.
And it's 4 years of podiatry school. And then after that, you have to complete a surgical residency, which is 3 years as well. So it was a total of 11 years postgraduate. Yep. So.
Okay, so is this your first position after that?
Yes, it is. Yep. And after podiatry school, I went to residency through University Hospitals. I was based out of Richmond Heights.
Okay.
And that's a great program because we are affiliated with a lot of different of the different health systems in Ohio. So we worked with the Cleveland Clinic, University Hospitals. We went out to Lake Health Systems. So we had a really great networking in our residency program. We're affiliated with over 50 podiatrists. So I pretty much know anyone and everyone in the area, so it was a really good program to have a lot of great mentors.
Can you specialize in different parts of podiatry?
Yeah, you can. There is geriatric medicine, there's diabetics, you can do wound care, you can do forefoot surgery, rear foot surgery, you can do trauma. There's a lot of different, that's another great thing with podiatry, there's so many different avenues you can take.
We had somebody on talking about wound care and spent a lot of time talking about foot care and especially, if you're diabetic and that you need to see the doctor a lot.
Yeah, so that is one thing that I am pushing is for diabetics to get the word out that how important it is for them to see a podiatrist. When you're a diabetic, it really affects your blood and your nerves, and that is important because getting blood flow to down to your foot, you want to make sure if there is a wound, if you can heal it, and that is, it can take a downward spiral. So it really is important for diabetics to prevent something before it happens. And, if there is something, coming in to see us quick to, getting it fixed as quickly as we can.
Okay, now this is, I don't know if it's putting you on the spot question, but if somebody ends up needing to have like a toe amputated, is that because they didn't see their podiatrist enough, or is...
Potentially. We like to prevent that. However, is it just because they didn't see a podiatrist? No, it could be a whole lot of different factors. But the sooner you come in and we can assess and see what needs to be fixed and what you need help with. If you're not getting a lot of blood flow to the area, we have vascular surgeons and doctors that we can send you to in order to see what we could do to get some of that blood flow down to the area to prevent amputations. We always want to prevent any amputations as best as we can.
Are there blood flow problems other than people with diabetes?
Yeah, there's a lot of different components that go into it. Yeah, you can have blood flow issues and not be a diabetic as well.
A little personal wise is that I go out running, and one day for some reason I was out running and it was slushy ice water and stuff, and I got home and I was taking a shower and my feet hurt like heck. And I went to work and somebody said you should go to the emergency room. So they went in and they relieved the thing and stuff. But ever since then, my feet are like numb. It's like you're walking on cotton. I don't feel a whole lot sometimes. So that's something that I should go see a podiatrist?
If you can't feel your feet, then yes.
I mean, I can feel a little bit, but...
you have some problems with, feeling and sensation. So that would be a type of neuropathy. So the nerves is what, allows you to feel. And if you can't feel, that's where you can get into trouble. You could have a nail in your shoe. You could step on something and not realize it. Or putting your foot in hot water. That could all lead to problems. So just knowing what, how bad the neuropathy is.
I mean, I go running for, 30-some years, I'm fine. And it's like 37 degrees out. It's not particularly close. It's not like it's below zero. Or
now, do your nails fall off because you're such a long-distance runner?
No.
No? That is something with runners. Your nails
I'm not real long distance. I go out and do it.
Well, that's good, though. Good exercise.
Yeah, it does have its hazards once in a while, I guess.
It does, I'm sure.
All right. So who else? Should everybody see a podiatrist at some point?
I would think, if you're having we are on our feet so much. Our feet is what gets us through the day. So if you're having any pain or discomfort, I think it is good to see a podiatrist so we could evaluate and see what you're doing. Your feet shouldn't really be hurting you. So if they are, we need to see what the problem is. So
just if you're a cash register...
On your feet all
the
day.
Time.
Yeah.
You should go.
Yeah, if you're in pain, we can see what we need to do. If a little anti-inflammatory would help you, if you need to get in proper shoe gear, some orthotics, there's a lot of different things we can do to help you.
Do people wear the wrong shoes?
How
about high heels? You got high heels on?
I don't. Actually, I have flats on, so I don't have very good support in right now.
Okay.
But yeah.
I don't have high heels on either.
No, not today.
No.
Actually, are you in good running shoes when you run?
I think so.
Yeah.
I probably don't change them enough.
Oh, I'm sure. Yes, that's very common. Yes.
They're cheap. They look okay, so you keep using them.
Right. You can really tell on the bottom of your shoe just to see how worn out it is. If your tread is gone, it's time for a new pair of shoes.
So I should have brought them in today.
You should have. Yeah. I try and have, I was dressing up for work for the first few weeks, and then I was just getting a lot of things on me and dirty, so now I pretty much do wear scrubs. So now in the scrubs I'm trying to wear supportive shoe gear to show patients what is good. I have them out in my car, but...
Well, I notice a lot of nurses, they wear like some kind of a modified tennis shoe, it seems like most of the time.
Yeah, just something that provides, comfort and holding your foot into place.
Right, something practical.
Yeah, when you're on your feet, you don't want them to hurt.
So do people wear the wrong shoes? I mean, you have a patient come in, what's the chances that they're wearing the wrong kind of shoe?
Sometimes I have patients that come in that aren't even wearing shoes. So,
Oh,
yeah.
they're just barefoot?
Or a sock, yeah, if their foot's really swollen.
Oh,
Yeah. So we always want to protect the bottom of your feet. And even if you can't get your foot into a shoe, there are some patients that come in with really swollen feet. And if they can't get their foot back into their shoe, I would at least provide them with what we call a surgical shoe. It's a Velcro top. That way you're at least having some protection of the bottom of your foot.
so why are their feet swollen?
Oh, gosh. That's a loaded question. So not getting blood back up to into your system. You can have lymphedema. So when your lymph system isn't normal, you can just get a lot of swelling into your feet. And one thing that University Hospitals is doing now is they're having a lymphedema clinic. So that is good too, because when I have patients come in that have a lot of problems with swelling and lymphedema in their feet, I'm able to refer them to a lymphedema clinic as well as a support group that they have. I think on Wednesday nights I can get that information, but
Okay.
yeah, we always want to make sure your feet are protected.
Now, as a runner, I see different shoes for tennis shoes and stuff for running and for walking and for hiking. Should you wear different shoes for different things?
I don't think it really matters.
Okay.
The support is really what's good. So if your shoes are comfortable, it doesn't, that's good. However, they make all those flexible shoes now where you can bend them and they're comfortable. But that's really not giving you a lot of support. When you have a shoe, you want to be able to bend it and just have it bend in the toe region. That way it's sturdy everywhere else, especially in your arch. You want to make sure you have a supportive shoe in your arch.
So you're big on having shoes on just for the support?
Yeah. And there's patients that, whenever they say they just hurt when they're walking barefoot, I suggest getting a pair of shoes just to have on indoors. You don't want to have your shoes inside and outside if, you don't want to.
I take my shoes off and walk around with stocking feet. That's automatic.
Yeah, if that doesn't bother you, that's okay. But for diabetics that I really want their feet protected, and if their feet hurt when they're not in supportive shoes, then I suggest they just get a second pair to have just for indoor shoes.
Have you ever heard, I read something about runners that, and I'll quit talking about running, but that run barefoot and that their feet grow to, I guess they get a tough
The calluses
on it. Does that make you cringe?
Yeah, I just can't imagine. I would just think that would hurt. But, everybody has their different point of views, and if that's what works for them, then that's great.
Okay.
I can't say that I recommend that.
All right, okay.
So, you step on stones when you run and everything, so how does that work?
Yeah, now I've run along the beach before, but then I'm kind of careful there too.
Right. Never know what you can run into there.
Yeah, I'm like running around along like the Gulf of Mexico.
Oh, sounds pretty though, and peaceful.
Yeah, especially with did you get a lot of wind and all coming in today?
Yes. Lots of stuff blowing my way. Then I have truckers passing me, and oh my gosh, stressful drive, but we made it.
Well, good. So when you first see a patient, what do you do? Do you talk to them about what they wear and?
Yeah, when a patient first comes in, I have them fill out a short sheet and a questionnaire. Have them fill out why they're coming in, a little bit of their history. Because even though I'm just a podiatrist that looks at their feet, I need to know the whole health history as well, because that all plays a part into your health. And I will go through and I do a foot exam, and there's 4 different departments that I look in. Your vascular, so your blood flow.
Okay.
The bottom, I do a little kind of testing to see if you can feel the bottom of your feet. That's your neurologic status, as well as I look to see if there's any ulcers, calluses, any breaks in skin. That's the dermatologic, so your skin. And then muscle strength, and if you have good muscle strength, if you have good range of motion, that would be the musculoskeletal. So there's vascular, neurological, musculoskeletal, and dermatological. Those are the 4 basic areas I review, and then we go into detail as to what's hurting, how long it's been hurting, what started it, was there trauma, all that.
People walk in and say my feet hurt. I don't know what happened.
Yeah, so being at the locations I'm at university hospitals, I can get x-rays on demand that, I can have the patients go get x-rays, and they are read within, they're read very quickly. And as soon as they're taken, I can review them as well. And the bonus to being with university hospitals is any x-ray or any imaging that's done, CT, MRI, I get to review it, and a reading radiologist does it as well. So you're having 2 doctors review each image that is done. So when people come in and say their feet hurt, we pretty much, if I feel it's necessary, just start with a radiograph and we can go from there. Osteoarthritis is really big in the feet, just wear and tear on your joints over time.
Really?
So that's a big complaint that patients will come in with. Plantar fasciitis, that's another big one too. That's
that plantar's warts? Is that what
no, that is the pain on the bottom of your foot. So a heel spur, people associate
I've
with
had
heel
that,
spurs. Yeah. That's actually, it's not the actual heel spur that's painful. It's the ligament, the band of ligament that attaches at the bottom of your foot. It's the inflammation of that band that's painful. It's not the actual bone spur. So I get a lot of plantar fasciitis as well.
Yeah, I've had, before with that.
Stretching, you gotta stretch. That's the biggest.
Yeah, there was some kind of like a thing that you put your foot in and kind of stretched it.
Night splint or
yeah.
So there's a lot of different things. Taking a small water bottle, and freezing it, and then taking it out and rolling your foot over that.
Oh.
With that, you're getting an anesthetic effect as well as stretching. So you're kind of getting 2 in 1. That provides a lot of relief from people.
All right, we're back. We have Jessica Milliman from UH. And are there other podiatrists with UH? Are you like the first one in a while?
In this area, yes. I had a colleague of mine who just graduated residency as well, Dr. Karen Rodriguez. She is in the Menor and Euclid office location. She was able to fill in from another podiatrist that retired. So there are university hospitals podiatrists. There just hasn't been one affiliated with UH in these locations, Conneaut, Geneva, and Ashtabula.
Well, there's a Nancy Rung, I think, that was a podiatrist around here for years, but she retired a while ago, and I didn't think there was anybody for a while.
Yeah.
Tell me about the bunion.
So a lot of people think a bunion is just a bone growth that, is on the side of your foot. It's actually a biomechanical issue where your bone is shifting, and it's just the head of the first metatarsal, which is one of the bones in your foot. It's not actually a growth on the side of the bone. Those can be sometimes painful when patients walk. They could be accommodated with wider shoe gear or putting, an orthotic or insert into your shoe to slow the progression. It's also genetic. A lot of patients wonder, how did I get this? And we'll usually say, well, you can thank your parents for that or your grandparents. There are some surgical procedures that can be used in order to fix the bunion, and that depends on the severity of the bunion to see what procedures surgically you would use. But you really don't want to do a surgical procedure unless it's painful and you're not able to function your daily lifestyle, without getting that corrected. With surgery, you really want to make sure you're there's always risks that go along with surgery, so you want to make sure that it's actually painful for you before you get a surgical procedure done. If it's just cosmetic, it's not, worth fixing a bunion. But if you are having pain in your, pain in your
So it's
feet,
possible to have one without any pain?
Oh, for sure, yes. I'm actually getting one myself.
Can we see it?
It's not that big.
No,
yeah,
I was kidding.
Oh, okay. I didn't even paint my toenails, so that wasn't going to happen today.
Sometimes my sense of humor. Oh, wait, she thinks I'm serious now.
That's all right. Actually, when the next time we were going to do this, I forgot Dr. Bryant and I were going to talk. We were going to have a guest come on, and I was going to go through the diabetic foot exam and what.
That's not a bad idea.
Yeah. And I could do that. I just need to make sure my toenails are painted next time.
Okay, so you...
Oh, another thing I was going to touch on was I am now visiting nursing homes as well. So I'm affiliated with a few nursing homes in the area, and I've been going there for a couple weeks now. So if there are patients in nursing homes, I am able to visit them. We dedicate a half day or a full day for me traveling to nursing homes and take care of foot exams and patients that are there as well. I know a few of the buildings that I go with, upon patient entering the facility, they'll ask if they have a podiatrist, and then they'll present them with a few different podiatrists that go to the area, and I'm one of them. And if they decide, then the nursing home will contact me, and I can go out there and see patients. That's been pretty nice so far.
I was talking, the person from the wound center yesterday was talking about how older people in nursing homes and all, that the podiatrist should cut their toenails. And he said that his own father asked him, because he's a nurse, and he said, no, you need to go to a podiatrist. So, and so why is that?
If you don't feel your feet, you could cut your nails and you could cut yourself and not realize it. And then if you have an open wound, it could lead to an infection, which, if it isn't treated, it could lead to an amputation. So you always just want to make sure you're careful. It's easier for your feet to be by my face than have you bend over and do these yoga poses trying to get to your toes and cut them.
Right, yeah.
And, there's, your nails can change over time. They could be thick, yellow, and, with just the toenail clippers that you buy over the counter, a lot of times your nails can become so thick that those wouldn't even trim them. So I get these nice nail nippers that, I can trim away easily. So that's one thing. I'll have patients that come in and say they use their garden tools to cut their toenails. That's not good. Talk about infections. So we don't
cut the branch.
I know,
I'm gonna cut my toe.
And actually, that I was cutting one patient, and she said she felt like she was in Dumb and Dumber. Do you remember that movie where where they were cutting the toenails and sparks were flying? That was funny for the patient to say that. That was funny.
So, what other problems do people like in nursing homes do you find because you're examining their feet?
Wounds, unfortunately. So when you are, non-mobile, which means you can't get up and walk around, and if you're in a bed all day, you can get pressure wounds to your heels, or you can just get skin breakdown over time. So, nursing homes definitely don't want that, and they do their best to prevent them. However, sometimes, nature will take its course, unfortunately, and we just need to prevent that and treat them and, make sure they don't get worse as time goes on.
Okay. Every doctor I've had in here says that exercise is important for whatever their specialty is. Is exercise important in your specialty?
It is, yeah. So when you are walking, running, any type of exercise, your calf muscles are contracting and relaxing, and that's allowing your blood flow, that's pushing your blood flow back up into the system because, gravity, it's hard to play against gravity. So when you're standing, your feet are down below your heart all the time. So it's really hard to get all that blood flow back into the system. So when you're moving your muscles, contracting, walking, your calf muscles are working to squeeze and, push that blood flow back up to where it needs to go so it doesn't pool in the bottom of your feet.
Okay. Do you detect other non-foot diseases by looking at people's feet, or is that a sign you need to go to your doctor to check on this or that?
Yeah, if I see something that I think needs to be, further investigated, I do have the ability to refer them out, which is nice. Rheumatologist, if you're getting, if there's just something else that I can't put my finger on, I would send you to rheumatology. There's vascular dermatology for some skin issues if I'm not able to correct it. So that is one great thing about being, connected in the network that I am. I have a lot of different resources I can send out to. And, I think that's a great, plus to me working with university hospitals.
Okay, going to the doctor, there's like problems sometimes with insurance. Somebody has problems with their feet and they put it off because they don't have insurance.
Right,
Well,
I can say that I accept most insurances, so that's always something we can look into. And for those that don't have it, I would still say give a call because we're always willing, your health matters, and we will get you in and do what we need to do, without that issue. There's a patient that doesn't have insurance, and, we will work with everyone individually. So do what we need to do because we want to make sure that everyone's taken care of.
So this may be a dumb question, but...
No dumb questions.
No dumb questions, okay. People with insurance that may not have, sometimes there's a rider for dental or a rider for optical, but the podiatrist should be handled under your normal medical insurance.
I believe so, yeah. You're right. I don't think there's an extra, fee to see a podiatrist. I don't know for sure, so I don't want to say anything, but for, we have been covered, we haven't had any issues as of yet, so.
Do you get, in reverse, do a lot of doctors refer patients to you?
Mm-hmm.
Because I guess the days when, like, your general physician, and then you took care of feet and everything else. It's
Right.
kind of
Right. Yeah, I'm getting a lot of referrals from the pediatrician. That yeah, that's good. Some kids kids can have feet problems too, and just a lot of primary cares, nephrologists, so kidney doctors, because that affects diabetes. So I've had quite a large referral base, which has been great.
What about like high school sports athletes?
Mm-hmm.
I would think.
Yeah, I haven't seen as many I've only seen a few so far, but yeah, I can definitely, I can treat and see anything of the foot and ankle, and if there's something I don't feel comfortable with, I would let them know and refer it out as needed. I will never just leave you hanging.
Mm-hmm.
I can say that.
What do you think about these people that kick the football without a shoe on?
It sounds painful. Gotta have the protection. It's a fracture waiting to happen.
Okay, but it is okay to walk around the house in stocking feet if it doesn't hurt or anything. No? Slippers?
Yeah, I just always want something on the feet, I would say.
How about
and especially
sandals?
for diabetics. I don't want to say anything if I don't know the situation and, your status of your feet. Sandals,
They're okay.
yeah, they're
I've got
fine.
it with cool Rolling Stones tongue, so
That
should
pretty
help.
cool. Right,
That should help, right?
That makes it better.
Yeah. Well, anything else you wanted to cover?
No.
How about can you kind of review your where you are?
Sure.
What days
So,
and that sort?
okay, days are right now. Mondays I'm in Geneva. Tuesdays and Wednesdays I'm in Ashtabula. Thursdays I'm in Kanya, and then Fridays I dedicate to nursing homes. My main number is through Ashtabula, so that's 440-998-0011. And that's the one phone number for all the office locations. Sometimes you have to leave a message, but my office manager, Patty, gets back to you right away. Oh, I thought that was...
Well, this is good. Yeah, I'm not going to answer that. So, see, everything's connected to my iPad, my iPhone, and all that kind of good
Oh
stuff.
my gosh, that's funny.
Yeah, but it's not even a number I recognize, so, all right.
Doing it.
Thank you.
Thank you.
Okay, so we were okay, so
Oh.
we gave you office days and,
Yep.
and where you are.
Yep.
Okay.
Geneva, Ashtabula, and Kanya.
Okay.
And whenever somebody calls, we always give you those three options, and based on the schedule and location, we work with you. So we'll let
Are there
you know.
foot emergencies?
Mhm. Yeah.
So that way, if somebody's in Kanya but you're going to be in Geneva that day, it might be good for them to hightail it.
Hightail it there, yeah. And if there really is ever, if it is an emergency, we do suggest going to the emergency room. They can take care of it, and then they can call me as needed as well. So any emergency should always go to the emergency room.
Okay.
So.
All right. Well, thank you very much.
Thank you for having me. It was a pleasure.
All right, Jessica Milliman. She's the new podiatrist as of August for UH hospitals, and she's in Ashtabula and Geneva and Kanya.
That's it.
All right. Thank you very
you.
much. And if you had diabetes, you got to go see her.
Come on in.
Yeah.
I don't bite.